Hello. Welcome to another video from 10x Investor Education. So in this video, I want to talk about two companies that ARK started buying yesterday. So those two companies are, one is Vuzix, VUZI symbol, and another company is a new IPO that went IPO on February 11th, known as Signify Health. Okay, so Signify Health is a big company, around $8 or $9 billion company. Vuzix is still a small company, so I'm going to cover both those companies in this small video. As you guys know, Vuzix is a stock that I have been covering in this channel for almost 3 months since December. So when it was start trading at $6, and you guys at that time itself know I had several hundreds of these stocks at that prices. Recently, I covered Vuzix as my one of the top picks in ARK Big Ideas 2021 as part of AR VR category. So interesting to see ARK buying this stock at $18, which went up almost 400% in last 3 months. So not just Vuzix, if you take Kopin, which is a pick and shovel play in this category, I have been covering that since $5. So lot of this AR VR glasses and other equipment, Kopin is the one which makes the displays. Okay, so not just with this Kopin, Roy, Mara, a lot of these stocks I covered at $3-4 just few months back. They went up from anywhere between 5x to 15x. So it is important to buy these at those levels rather than buying after they went up 5, 10, 15x levels. So that is the reason why I bring up these research, get these into this channel so that you can take advantage of those. So don't get me wrong, I'm still long on Vuzix. I actually bought more last night after seeing ARK bought, because when ARK buys the small caps, next couple of days, and it's not like first day they're going to buy and leave it. So they're going to accumulate, they're going to initial position yesterday, and they're going to obviously accumulate over a period of time. So which means there's a lot more people, there are millions of people are following on YouTube on what ARK Cathy would daily buying, and a lot more people are going to pump into getting the stock. That's the reason why ARK Vuzix went up already 10 or 15% last night after hours. So Signify Health did not go up because it's just not a small cap like Vuzix. So it is already $8 billion or $9 billion company, which went a public IPO at significantly so high price last week. So that's the reason why it won't go up, because it's easy for a $100 million company to go to $1 billion than for an $8 billion company to go to $80 billion company. I'm not saying it's not going to go, but 10x is going to take a while, which means they have to show lot of good quarters every quarter, increasing revenues, higher growth. Okay, so I'm not going to cover in detail of Vuzix again here, because I'll point 3 or 4 videos that I already took and link them in this video. But this video is about actually Signify Health. Okay, last night I did a deep dive into that company. I looked at a lot of videos spoken by CEO and also the company people, and I got a better idea what the company does and why ARK thinks this is going to be a disruptive technology, healthcare technology play in healthcare sector. So ARK bought the Signify Health as part of their ARK Genomic ETF. Honestly, I'm not very happy with ARK Genomics ARKG return so far this year. My best ARK funds are so far ARKF and Print. Both are doing really good, but ARK Genomics is still kind of going up and down, not huge growth this year. The reasons being, there are a lot of companies in ARK Genomics, they don't have consistent growth quarters. So that is causing the stocks go down a lot. That's significantly affecting the ETF itself. So it is a good time for them to add actually good companies, which they added one medical device company recently, which is also an IPO, 908 Devices, and also another company. So another life health sciences company also they added. So those companies, I think they have lot of revenue potential growth. For example, I'll show this company Signify Health. They already make around 500 million, which is $500 million revenue year. Last 2018 2019 they have been consistently growing a little bit, not at a very rapid pace, but still they are making a ton of money. So I think that is the good sign for Organomics to have a companies that making a lot of revenue rather than just speculative companies. Okay, so the CEO of this company, Kyle Armbrester, is a very smart guy. He is an Harvard MBA. So I looked his profile very deeply. So anytime I invest in a company, I look at CEO, I look at the board, and is it really a real product they are selling, or is it just a fluff that they are making up? Right, that's most important. Okay, so this company just brand new. It's a combination of two companies in 2018. From since then, this guy Kyle, who has been in Athena for multiple years, came here, took the CEO, and is running the show here. Okay, so at pretty high valuations, they went IPO at $7 billion just last week. So if you look at it, what is Signify Health? Okay, so I'll try to keep it very simple. Okay, so Signify Health comprises a network of more than 4,000 physicians and nurse practitioners provide in-home at the home, okay, in-home healthcare services for more than, I think right now 1.4 million. Okay, they are growing. It used to be 1.1 million, now it's like 1.4 million members annually. So they work with a lot of states, a lot of healthcare companies like Humana, BCBS, to keep patients at home and provide health holistic approach of healthcare rather than taking the patients to hospitals and facilities and get those tests done there. Okay, so there is so much difference if you get your ultrasound with a small device at home, then you take them to an ultrasound facility at expensive hospital, right? It is like 10 times difference. So if a nurse practitioner goes to patient home and treats them for 2 3 times rather than patient going to hospital stays at like 7 to 10 nights. So if the cost of Signify Health can show, hey, this is $3,000 versus hospital stays like $30,000, right? 10 times. So they have advanced analytics. They can show like this. Okay, so my nurse practitioner and doctor went treated this patient 3 times in the last 3 weeks, and you can see the outcome is very effective. Instead of the patient coming to hospital and staying the 10 days, $3,000 per night, and then $30,000, right? So that is how they show, and they show what is known as value based healthcare. So they show that, hey, Humana, you saved $27,000 by me treating the patient rather than you providing whatever they want to go to hospital, right? So that is, I think, the disruptive part of it. So you need to have a combination of technology and trained people, so they don't have to employ a lot of doctors to do this. They can do with a lot of nurse practitioners overseen by few primary care physicians. Okay, so that is the, I think that is a kind of disruptive factor they're trying to do. Do you think this is the only company that's doing it? No, there are a bunch of startups, and you see a lot of the startups actually going to IPO next couple of years, which is a good sign because they are in the early stages and they already got billions of dollars in IPO money, and they have been already acquiring companies to make this more practical, and they can go and increase the number of patients they serve and go to more states, get acquired, and then, so for example, if the same patient who they have been treating for 3 days at home, and if it goes to by any chance to hospital and makes a big bill to Humana, Signify Health has to pay that money. Okay, so if you don't show the results based care, okay, if you don't show the results and you are reducing the cost, you are paying the premium to Humana now. So that is the reason why they need to keep track of their analytics, which is make sure like, hey, what are we doing with the patient so that patient doesn't have to go to hospital again, so, and bill thousands of dollars to healthcare. Okay, so how do they do it? I'll play a small clip at the end of the video, given by both CEO and CFO and chief medical officer, to show how they are doing it. Like 2-3 minutes video, it should give an overall idea. Okay, so what am I doing with this stock right now? So I invested after hours some money, but on March 4th, they are going to have, not at the March first week, they are going to have first quarter results. Okay, so ARK buying, they can average it out, right? They can buy at this price, at this price, and at this price. Okay, so we don't have that kind of money, so we have to invest our money wisely. So I'm not investing huge amount in this one. I bought some quantity, and then I will wait for first quarter and see how it goes. Based on that, I will, it's not going to go like penny stock. It's going to go 50%, 100%, right? So there is like, if they do really good, 10-20% it'll go up. So but it'll go up gradually, slowly. It'll go up like 30, 40, 50% over a period of time, rather than doubling in a day. So that is my strategy. Invest some money, and then based on first quarter and second quarter results, build up a position in the stock if the disruptive factor that are thinking is going to happen. Okay, so remember, healthcare is very complex, and there is not a single solution to this. Okay, so right now the trend is value based healthcare, because these health insurance companies, every day they are unable to control the cost, and every year the costs are going up. Okay, so they are coming up with any ideas to solve this healthcare cost. If you remember, uh, Atul Gawande, which is a major surgeon and public healthcare person, actually took an initiative, a common healthcare company initiated by JP Morgan, Berkshire Hathaway, and then Amazon, so known as Heaven. So they tried to start that initiative like 3 years back, and the company went for like 1 or 2 years, and then they shut down recently. So it's not very simple to fix healthcare with a single solution. So telemedicine, certainly, living on teledoc, that kind of solution is part of the solution, but it's not 100% solution. So as the older people, as the people population gets older, so what this value based healthcare is showing them is that let them not get to the hospital or whole home based, you know, nursing care facilities which are expensive, hospitals which are expensive. Rather, providers such as nurse practitioners and also primary physicians, if they go to the homes and serve at the home convenience, that is more economically advantaged. And you got BP checking, small scale ultrasound checking, sugar levels, all these things can be done at home with small short devices, rather than taking them to hospitals and getting them all these tests and keeping them in beds for so many nights. So that is the plan of Signify Health. I think it's working for last couple of years. They have been growing steadily, and revenue is growing, the patient volume going, more healthcare companies actually using them, so their services, and they have advanced analytics that plugs in and shows that how the patient needs to be treated with all other complications, other all complications that they have. So hold on for a second. I will play this video quickly, and then you can decide whether you want to really invest in the stock. Okay, so I am not your financial advisor. Don't think as this is a financial advice to buy either Vuzix or Signify Health. These are purely, I bought Vuzix long back. I also bought last night. I bought this company again last night. In general, I do not make a video or cover any company unless I have the stock. I did do deep dive research into that. So you can keep faith on that, and please click the like button. Please, what you think, please let me know what you think if you like this both companies, and please provide a comment so that I know whether you like this kind of videos. Thank you, and see you on my next video. These are my previous videos of Vuzix. If you go my channel and you search for Vuzix, and then you will see all 4 videos. Recently I covered with ARK big ideas as Vuzix as my one of the top picks, and also I covered like since December 16th when Vuzix was $6. Okay, so there are a lot of videos in Vuzix already. You can watch one of them. I would recommend watching this because this has a lot more companies that I recommend, which have still, there's a lot of chance that ARK might buy one or two of these. Okay, so let's get back to Signify Health. So I watched this. This is like 30 minutes video. I'm not going to play this video here, but I recommend if you are interested in actually investing Signify, I will put a link, and I recommend actually go and watching this video. This is a very smart guy from Harvard MBA, and then he talks. I mean, he prepared well for the speech, but he talks really what really makes sense rather than talking some fluff. Okay, so what is Signify Health? Okay, so Signify Health launched in December 2017 as a result of merger between Conscio Health and Advanced Health. So two companies merged. The company led by former Athena Health executive Kyle Armbruster manages a nationwide network of 4,000 doctors and nurse practitioners delivering healthcare services in home to over million. Okay, I think right now it's 1.4 million Medicare Advantage members each year. So, and recently they have been acquiring small companies. So another company started by GMO Rubin MD, a former cardiac transplant anesthesiologist, launched TAV Healthcare in 2011 with the goal of creating longitude social records that can be merged with the clinical records. Okay, so they bought another company known as TAV Health. I will see what TAV does health. Okay, Signify executives said the acquisition of TAV Health as a curated network of community-based organizations and technology capabilities to direct manage social determinants needs upon benefits of clients, creating a closed loop between identification of social needs. So what does it really mean? Okay, a lot of terms are here. So if the patient, okay, once the nurse practitioner goes to the patient home and the patient needs, let's say, patient doesn't have enough food to eat, or he needs some carpenter help to put a handrail so that it doesn't fall, right? So all those volunteer services organizations are tied to this network, and they immediately connect to that network and say, hey, you need free meal delivery service, you need help with this volunteer organization, you need help to fix some faucet issue, right? So they'll type with all these things, and then they'll improve the social quality of the social needs of the patient, so that patient can actually more strong and mentally free and focus on treating the disease. Okay, so a surprisingly high percentage of health outcomes are driven by social, environmental, and behavioral factors. So basically, so for example, a patient falls while taking a bath, right? So you go to hospital, admits for a couple of days, and then they treat the fall injuries and send back. Okay, but nobody is fixing what is the root cause of the patient falling initially, right? So that is what in environmental factor. Okay, so what is social factor? The patient needs food, or the patient daughter doesn't have care when patient goes to hospital. So those are environment social needs that cannot taken care by hospitals, right? So patient needs driving to somewhere to for a test, right? So those social needs, what this TAV Health doing is they're tying up with patient to the correct volunteer services, so that they're taking care of it. The social worker from Signify Health will take care of those, and patient is treated with whatever needed. Okay, so behavioral factors, Armrester said, while we have rich data on these factors from what our clinicians capture while caring for the members in the home, healthcare has historically had a last mile problem on connecting the need for fulfillment. Okay, so this is what in short they do. Okay, that is the reason why it is not very complicated technology and anybody can repeat it. So but it is, they are in the first players, and they are already getting, a small company, $100 million company cannot do this kind of things because they need get billions of dollars of contracts with these healthcare companies. Okay, so this is the TAV Health technology they acquired, directly manages their clients' social determinants of health needs. Okay, so TAV Health network of community-based organizations is exactly what I'm talking about. The volunteer organizations to enroll clients in programs and services that support social determinants of health needs. Okay, so when we remember Signify Health, you have to think about social determinants. Okay, so this is a CEO. He is Kyle Armbruster, and he's a CEO for a while, almost 2017, and then he worked at Athena Health for 7 years, which is also a huge company with a lot of revenue, and he's an MBA from Harvard Business School. Okay, so this is coming back to the revenue of Signify. This is the most important. It doesn't matter if how CEO is good, how disruptive they are. And at the end of the day, they're not going to make revenue. They are not going to grow. The company, I'm not interested to invest. The company is not going to 5x or 10x. So that is the most important thing I look at it. Okay. So how disruptive they are and how the revenues are going up. So Signify total revenue was 502 million, it's close to half a billion. Okay, at the end of December 2019, up from 48% from 338 million 2018. So it was 338 million and 502 million and 2019. So 2020, so up to September 30th, the total revenue of 417 million. So easily they will beat 502 million, but it might not be the same growth as 48%. Okay, the company has sizable losses, reporting net loss of 28 million in 2019, 15 million 9 months ending. Okay, so honestly, 28 million loss on $400 million or $500 million is not a huge, so they could easily cover, but they should not be trying to be profitable. They should be growing, and that's what I think, that's what IPO money provides it. Okay, so we believe our financial model is attractive and highly recurring revenues, strong EBITDA margins, and high cash flow conversion, the company said. Okay, so basically, COVID-19 affected a lot, right? So that is the reason why I think 2020 is not a good year for them. That's the reason why you don't see 48% growth. But I think 2021 should be a really good year and a lot of these evaluations. Okay, so this is what it is. I'm going to play a short video here coming from actually this company itself. And please, focus for a few minutes. And after this, I will let you know what I'm thinking about my position in this company.
Healthcare for way too long has been focused on consumption and not actually driving value, better outcomes in a really human-centered way. We need to be able to recreate a healthcare system that is great for all the participants involved: payers, health systems, employers, and most importantly, the patients. To do that requires two big changes. Number one, we've got to go out and create value-based care payment programs. This helps align incentives and ensure that we're driving value for all constituents. Number two, we are moving beyond the facility-centric view of the world and instead taking a look at the entire continuum of care as a possibility to actually drive better value and outcomes for individuals' lives.
There's a huge opportunity in this country to resolve a lot of the inequities in the healthcare system and also bring forward a lot of the aspects of the social side that I think will make a long-term difference in a lot of people's lives.
Signify's mission is to change the way that we finance and deliver care, primarily through delivering more happy, healthy days at home. We've moved beyond a facility-centric viewpoint and instead have activated the home and the community as a place for folks to recover and to have a positive care journey experience that leads to better outcomes.
When you think about the home, it is the best place for the person when they're ready to begin that recovery. They're with their family, they get to sleep in their own bed, they get to really enjoy life. All of that really drives not only patient improvement, but patient satisfaction, improved quality of care, and ultimately, if the patient is stabilized in the home, it reduces the overall cost of care throughout that continuum.
So here at Signify Health, there's two main aspects of our business. One is our in-home health evaluations, where we're in the homes of over 1 million individuals a year. The second is our episode of care business, where we're managing over $6 billion in spend. When we bring those two things together and it's centered around a person, the opportunity for us to actually go in and disrupt healthcare, to go in and enable our clients' success in value-based payment arrangements is one of our biggest differentiators as a company.
I just wanted to let you know I am heading your way now, and it looks like I'll be there in about 13 minutes.
As we begin to deliver on the promise of healthier, happier days at home, there is not a better setting to engage with an individual. It is the only opportunity as a provider of healthcare services to see somebody in a holistic picture. Now, if you put yourselves in the shoes of the folks that we're serving, those that are the most vulnerable, our senior population, our providers are going into their home, they're sitting down at that kitchen table, and you can open up the medicine cabinet, you can see the list of medications, you can actually tell if they're taking the pills or not. It is firsthand experience for how that individual is living today. We're spending on average of an hour with them, listening, talking, empathizing with their current situation. The amount of trust that we're able to build on behalf of our clients is incredible. We're able to bring in devices and advanced diagnostic equipment. We're able to partner with biopharma organizations to bring in advanced therapeutics. The opportunities from there are endless.
One of the big gaps today when you think about a patient's journey is there are handoffs all along the way. There's a handoff from the acute or the first event to the rehab facility. There's a handoff then from that rehab facility to a skilled nursing facility. There's a handoff skilled nursing to a home health agency or home. Holistically, we manage that patient with limiting the misses that could happen in those handoffs, keeping the primary care in the loop.
A lot of the members keep in touch with me. Thank you for not only being very kind and professional, you actually brought back to me hope. Something I thought was gone forever. Thank you again for helping restore some faith in humanity.
My hope and dream for Signify is at the end of the day, we will create a happier, healthy, more engaged community and home for our families and loved ones to recuperate and get better and thrive in. This is what I want for my children. This is what I want for myself. And this is why we show up every day to create this new and human-centered version of healthcare for our nation. Healthcare for way too long.
So, what do you guys think, guys? So, do you guys like what Signify is doing? Please leave a comment. As I said, I invested already into this company, small amount, and then I'm going to wait for the first quarter result and see where it goes. And if ARK keeps buying and accumulating, I'm going to add more stock to my position and have a long term in this company. So hopefully you like the video. Please click the like button and see you on my next video. Thank you.